Hi, I'm Dr. Brothers. This is Lily. Today we're going to talk about geriatric anesthesia because I know for a lot of pet owners that can be a topic that's really stressful, putting your older pet under anesthesia, but we're here today to go through it with Lily. She's 11 years old. We already did all the necessary pre-op workup where we did blood work. We know from medical history, she has no abnormal medical history. She also doesn't have any medications and her blood work came back as normal. So she was just dropped off. We just chatted with mom. We're gonna do her first. So older patients, the protocol is to do them first for a couple reasons. Because we can monitor them for longer after the procedure's complete, but also it's better to get them home sooner than later so they can be with their pet parent and they can recover at home where they're the most comfortable. So right now we're going to do the first step in getting her ready for anesthesia, and that is giving her pre-med. Brandy's going to help us with that. Pre-med, and that is just an injection into their muscle. And we give it in the back thigh. And she's doing so good. Sometimes we'll give some oral medications at home, like a sedative, to help. There we go. She did so good. Okay, she's even wagging her tail for us. So now we're gonna put her in her cage, and you notice that the area that we keep them is open to the treatment area. So we always have an eye on them as they have before surgery, after surgery, when they're waiting for their pre-med to kick in. So now she's just gonna relax. We're gonna monitor her. When she's more sleepy, that's when we'll start placing her IV catheter and we'll get her under anesthesia. So we just placed the IV for Miss Lily. She did really well, and this is what it looks like. We wrap it up. So the next step is to place the endotracheal tube. She just got her what's called her pre-medication. So those are IV medications, and those can vary for our geriatric patient. It's very patient specific, their protocol of anesthesia. It depends on their medical history, different comorbidities they have going on. If her blood work came back abnormal, like her liver or kidney function was compromised, we might pick a different treatment protocol and different injectable pre-medications. So it is very specific to the patient. If she has cardiac issues, we might alter the meds. So it is something that we take very seriously, and we're very thorough in regards to knowing the patient so we can make a complete anesthetic protocol that's appropriate for that patient. So we'll place the endotracheal tube and she will go under anesthesia. We use ISO gas, and then we'll place all of her monitoring equipment on. We do that for every patient, but just that more important for a geriatric patient. So we can monitor heart rate, blood pressure, respiratory rate, all of those things. If they're altered in any way, we can see it right away and adjust the treatment accordingly. So this is Lily waking up from anesthesia. We have her set up as comfortable as possible, again in a cage that's open up to the treatment area so we can monitor her recovery. Making sure that the comfort and her warmth, her temperature are all adequate. She's nice and toasty warm. We do monitor her as well as she's recovering. We do this with all the patients, but just that more important with the geriatric patient, to keep them nice and comfortable and to be able to monitor them very closely in the treatment area. So her owner's going to pick up in a couple hours so that we can continue to monitor her and make sure she's recovering well. But, walking the line of monitoring versus getting her home as soon as possible so that she'll recover best at home with her family. So overall, geriatric anesthesia is something that can be very safe. When it's done in the right way, with the right prep work and the appropriate monitoring, and adjusting for that specific patient, it is something that can be quite safe and rewarding as the patient gets the care that they need So Lily is going to absolutely be a lot more comfortable and pain-free with the dental she just had. So we don't want to think about anesthesia as something that we shouldn't or cannot do on our older patients because it truly is something we can do. So if you have any concerns or questions further from this video, feel free to reach out and let us know. We'd be happy to help.